Ever get a medical bill and you're like, what in the world?
Oh, yeah.
Yeah, we've all been there.
Absolutely.
Today, we are diving deep into a world that directly impacts those bills.
Mm.
And this is wound care documentation and coding.
Okay.
It's a system that can seem like a secret language, but understanding it can really empower you as a patient and help you kind of navigate the healthcare system with more confidence. But before we get started, I do want to give a big shout out to London Heartbeats Z Academy for their support in making this deep dive possible. They offer over 150 incredible courses on various healthcare topics.
Wow.
So if you're intrigued by what you hear today, be sure to check out their offerings and follow them on Facebook, Instagram, Spotify, and YouTube for free, regular updates.
Great resources.
Yeah, you won't want to miss future discussions like this one, I'll tell you that.
Absolutely.
Now, you might be wondering why wound care coding matters to you.
Right.
Well, think about it. Accurate documentation and coding directly affect billing, insurance claims, and ultimately how much you pay for your health care.
Yeah.
We're going to be taking a close look at a presentation focused on proper wound care documentation, breaking down the complexities, and highlighting why it matters for both medical professionals and patients like you.
It's fascinating how often we overlook the crucial role coding plays in our healthcare experience. Getting it right ensures that everyone involved, from physicians to insurance providers, are all on the same page, and that leads to smoother processes and fairer billing practices.
Absolutely. And the presentation kicks off by emphasizing the importance of understanding the nature and origin of a wound. It seems like a simple concept,
Right.
but I'm already sensing there's more to it than meets the eye.
Yeah, you're right. There is a lot more nuance to wound care than simply slapping on a bandage. For instance, differentiating between a laceration, which is a tear or cut in the skin, and a pressure ulcer, which develops from prolonged pressure on the skin.
Okay.
That's crucial.
So how does this distinction actually affect my medical bill?
Okay.
Are we talking different treatment approaches?
Yeah,
Or something else entirely?
both, actually.
Okay.
The cause of a wound directly influences the treatment plan, which then dictates the specific codes used for billing. Take a toe ulcer versus a heel ulcer.
Okay.
One could indicate diabetes as the underlying cause, while the other might point to pressure sores. This difference in origin significantly impacts the course of treatment and the associated costs.
That's incredible. I never realized that something seemingly straightforward like the location of a wound
Right.
could have such a ripple effect.
It really highlights the interconnectedness of medical care and documentation. Moving on, the presentation delves into the significance of staging, particularly when it comes to pressure ulcers.
Staging, is that like categorizing them based on severity?
Precisely. Pressure ulcers are classified into different stages based on their depth and the extent of tissue damage. Stage I is the least severe, characterized by persistent redness of the skin that doesn't blanch, meaning it doesn't turn white when you press on it.
So it's more than just a fleeting redness.
Yeah.
It's a sign that the skin is actually being compromised.
Exactly. And as we move through the stages, the severity increases. Stage 2 involves partial thickness skin loss, where the top layer of skin is broken, exposing the dermis beneath. Imagine a scrape or a blister, but one that signals a deeper issue.
Okay, I'm starting to see the visual differences between these stages.
Yeah.
What about the more severe cases?
Stage 3 is where things get more serious. Here we see full thickness skin loss, meaning the wound extends through all layers of the skin and into the underlying subcutaneous tissue.
Wow, that sounds painful.
Yeah.
Does that mean muscle or bone is visible at that point?
Not yet. That's the hallmark of stage 3, the most severe stage. In stage 4, the damage goes beyond the skin, exposing muscle, tendon, or even bone underneath. You can imagine the complexity of treating a wound of that magnitude.
It's truly eye-opening to understand the nuances of these stages. It makes sense that accurate staging is vital for both treatment and coding.
Absolutely. The stage determines the level of care required, the types of dressings and therapies used, and as we've been discussing, the resources and costs associated with treatment.
So if a wound is misstaged,
Yeah.
could that lead to discrepancies in my bill?
It's certainly a possibility. Inaccurate staging could lead to either undercoding or overcoding, resulting in financial repercussions for both you and the healthcare provider. Undercoding means the healthcare provider might not receive adequate reimbursement for their services, potentially impacting the quality of care you receive in the long run.
And overcoating, I'm guessing that translates to a bigger bill for the patient.
Unfortunately, yes.
How come?
Overcoding means you could end up paying more than you should for the treatment received simply because the documentation didn't accurately reflect the true stage of the wound.
This underscores the importance of getting it right. I'm starting to see how much power lies in those seemingly technical details.
Precisely. And speaking of technical details, the next section of the presentation tackles a topic that often sparks curiosity: debridement.
Ah, debridement. I know it involves cleaning out a wound,
Mm-hmm.
but I'm guessing it's more intricate than just a simple scrub.
You're right. It's a much more nuanced process than just cleaning. Debridement is the removal of dead, damaged, or infected tissue from a wound to promote healing. And there are two main types: excisional and non-excisional.
Okay, let's unpack these two types. What makes them distinct, and why is it so crucial to differentiate between them in documentation?
Excisional debridement, as the name suggests, involves surgically cutting away the dead or damaged tissue. It's a more aggressive approach, often requiring instruments like scalpels, lasers, or specialized debridement tools.
That sounds intense. So what about non-excisional debridement? Is that a gentler approach?
Exactly. Non-excisional debridement encompasses a range of techniques that don't involve surgical removal of tissue. Think of it as a more conservative approach.
So what are some examples of these gentler techniques?
There's mechanical debridement, which uses physical forces to remove dead tissue. This could involve wet-to-dry dressings, where a wet dressing is applied to the wound and allowed to dry, pulling away dead tissue as it's removed. Then there's enzymatic debridement, which uses specialized enzymes to break down and dissolve dead tissue.
Enzymes. That sounds pretty high-tech for wound care.
It is, and there's another surprising technique that falls under this category: maggot therapy.
Wait, what? Maggots.
Yes.
Are we talking about the little creatures you see in, well, less pleasant places?
Yes. Believe it or not, certain types of maggots are carefully bred in sterile lab settings and used in wound care because they have an incredible ability to selectively feed on dead tissue, helping to clean and debride the wound.
Wow, that's both fascinating and slightly unnerving.
Right.
So from high-tech enzymes to those tiny helpful creatures, it seems like non-excisional debridement covers a wide spectrum.
Absolutely. And while it might seem less complex than excisional debridement, the documentation still needs to be clear about the specific techniques used to ensure accurate coding.
This deep dive is already revealing so many layers of complexity I never even considered.
And it gets even more fascinating. The presentation goes on to highlight the importance of something called physician queries, which play a crucial role in ensuring accurate documentation and coding.
Physician queries. That sounds a bit like an interrogation.
Sure.
What are they?
Uh-huh.
And why are they so important in this context?
Think of them as friendly requests for clarification rather than interrogations.
Okay.
Physician queries are essentially communications between coders and physicians to clarify missing or unclear information in the medical record. For instance, if a patient with diabetes presents with a leg ulcer, a coder might send a query to the physician to confirm if the ulcer is related to their diabetes.
So it's like detective work, making sure all the pieces of the puzzle sit together perfectly.
Yes.
But why is that specific clarification so crucial?
Because that one detail, whether the ulcer is diabetic or not, impacts both the treatment and the coding. A diabetic ulcer requires a different approach than a non-diabetic ulcer, and the coding needs to reflect that distinction accurately.
I'm starting to grasp the interconnectedness of everything.
Yeah.
A seemingly minor detail in the documentation can have a significant impact on the entire course of treatment and billing.
Precisely. And to illustrate this impact further, the presentation delves into the real-world consequences of inaccurate coding, citing findings from the RAC program, the Recovery Audit Contractor Program. Have you ever heard of it?
I can't say that I have.
Okay.
What is the RAC program, and how does it tie into this discussion about wound care coding?
The RAC program is a government initiative designed to identify and recover improper Medicare payments. Essentially, they act as watchdogs, reviewing medical records and billing claims to ensure everything is above board.
Okay.
And guess what?
What?
One of their biggest areas of focus has been incorrect coding of excisional debridement.
Seriously? So hospitals were billing for excisional debridement when it wasn't actually performed. Or perhaps the documentation wasn't specific enough to justify the code.
You hit the nail on the head. Both scenarios have been uncovered through RAC audits, leading to millions of dollars in recovered payments. It highlights the importance of meticulous documentation and a thorough understanding of coding guidelines, especially when it comes to procedures like excisional debridement.
Wow. This is eye-opening. I never realized that financial stakes were so high.
Mm.
It makes me appreciate the behind-the-scenes work that goes into ensuring accuracy and preventing these costly errors. But I have a feeling we've only just scratched the surface of this intricate world. What else does this presentation delve into?
You're right. We've covered a lot of ground already, but there's still so much more to uncover. The presentation goes on to explore specific case studies and examples of coding errors, highlighting the areas where things can go wrong and the steps that can be taken to prevent these errors. We'll delve into those details in our next segment.
Hold on to your hats, everyone, because this deep dive is about to get even more intense. We'll be back in a flash to explore those case studies and uncover even more insights into the crucial world of wound care documentation and coding.
And those case studies, they really showcase how those physician queries we talked about, they act as safeguards against coding errors. They might seem like small details, but they can have a big impact.
Okay, I'm ready to put on my detective hat and analyze a case. Give me a scenario where these queries come into play.
All right, picture this. A patient comes in with a pressure ulcer, and the nursing notes describe it as stage 3, meaning it extends through the skin and into the underlying tissue. However, the physician's progress notes don't mention the stage at all.
Ooh, that seems like a pretty significant oversight. I can see why a coder would raise a red flag there.
Exactly. In this situation, the coder would send a query to the physician asking them to clarify the stage of the pressure ulcer. This simple act of communication can prevent a potential coding error and ensure everyone is on the same page regarding the severity of the wound.
That makes perfect sense. It's all about connecting the dots between different parts of the medical record. But what happens if the physician is unsure about the stage or doesn't respond to the query promptly?
That's where the coder's expertise truly shines. In those situations, they need to use their clinical judgment and code based on the available documentation, taking into account all the details from nursing notes, wound assessments, and any other relevant information.
So it's a blend of medical knowledge and coding expertise. They need to understand both the clinical picture and the intricacies of coding guidelines.
Precisely. Wound care coding requires a unique skill set, bridging the gap between the clinical world and the billing world.
It sounds like a demanding job, requiring meticulous attention to detail and a deep understanding of both medicine and coding.
It certainly is. And the presentation highlights just how crucial this role is by showcasing other common coding errors that can occur. One frequent mistake involves confusing excisional debridement with other procedures. For instance, if a surgeon performs a skin graft and also debrides the wound, some coders might mistakenly bill for both procedures separately.
Wouldn't that be considered double billing, leading
Boy,
to inflated charges?
Exactly. In many cases, the debridement is considered an integral part of the skin graft procedure and shouldn't be coded separately.
So coders need to be aware of these nuances in coding guidelines and apply them judiciously to prevent overcharging.
Absolutely. It's about understanding the bigger picture and ensuring the codes accurately reflect the services provided, avoiding any unnecessary or incorrect billing. The presentation also emphasizes the importance of clear documentation when it comes to the depth of debridement.
Now, remind me, why does the depth of debridement matter so much for coding? Is it about the complexity of the procedure or something else?
Remember how we discussed the different layers of the skin? From the epidermis to the subcutaneous tissue and beyond?
Yeah.
Well, the depth of debridement dictates the complexity of the procedure and consequently the specific code used. If the debridement extends beyond the skin and subcutaneous tissue into the muscle or even bone, it requires a different code than a more superficial debridement.
So if a surgeon debrides a wound down to the muscle, the documentation needs to clearly state that to justify the use of a more complex code. It's all about those crucial details.
Precisely. And it's not just about using fancy medical jargon to impress the auditors. The documentation needs to be clear, concise, and easily understandable for anyone reviewing the medical record, ensuring transparency and accuracy.
What about the instruments used for debridement? Does that factor into the coding as well?
It can, especially when distinguishing between excisional and non-excisional debridement. The presentation points out that simply mentioning scissors in the documentation isn't enough to justify the use of the excisional debridement code.
Why is that? Aren't scissors used for cutting?
They are, but scissors can also be used for more conservative techniques, like loosening and removing fragments of dead tissue without surgically excising or cutting away healthy tissue.
So to code for excisional debridement, the documentation needs to specify the use of instruments like scalpels, blades, or lasers, which are more definitively associated with surgical removal of tissue. It's about painting a clear picture of the procedure performed.
Exactly. It's those seemingly minor details that make a world of difference in the coding world. They ensure accuracy, transparency, and ultimately fairness in billing practices.
This deep dive has given me a whole new appreciation for the complexity and importance of medical coding. It's like a hidden language that underpins the entire healthcare system.
That's a great way to put it. And just like any language, it has its own set of rules, nuances, and constant updates.
Speaking of updates, the presentation we're exploring focuses on ICD-9 codes, but I know the healthcare industry transitioned to ICD-10 codes a while back. Does this shift change everything we've discussed so far?
It does bring some changes, but the fundamental principles we've been highlighting, accurate documentation and understanding the nuances of coding guidelines, those remain the same. ICD-10 codes are simply more detailed and specific, allowing for greater precision in describing medical conditions and procedures.
So it's like going from basic vocabulary to mastering a whole new level of nuanced language.
Exactly. And while it might seem daunting, there are plenty of resources and training available to help healthcare professionals navigate the world of ICD-10 coding.
That's reassuring. It sounds like continuous learning is essential in this field, given the constant updates and evolving guidelines.
Absolutely. Staying informed and seeking ongoing education are key to ensuring accuracy and staying ahead of the curve in the ever-changing world of medical coding.
This brings us back to London Heartbeats V Academy and their commitment to providing comprehensive healthcare education. Their courses on ICD-10 coding and wound care documentation seem incredibly valuable for anyone involved in this field.
I couldn't agree more. Their courses break down complex concepts into understandable modules, making them accessible and engaging for learners at all levels. And their social media presence on Facebook, Instagram, Spotify, and YouTube provides a fantastic platform for staying updated on the latest developments in healthcare.
It's fantastic that they're making this knowledge readily available and engaging for everyone. Okay, we've explored the nitty-gritty of coding errors, the crucial role of physician queries, and even touched upon the transition to ICD-10 codes. What other insights does this presentation have in store for us?
Well, the next section delves into the often dreaded world of appealing denials, specifically focusing on excisional debridement claims. This is where things can get even more intricate as it involves navigating the world of insurance companies and understanding their specific requirements.
Appealing denials, that sounds like a legal battle.
Yeah.
What are the key things healthcare providers need to keep in mind when fighting for those reimbursements? Is it a David versus Goliath situation?
It can feel that way sometimes, but the presentation provides valuable guidance on building a strong case, emphasizing the importance of clear, compelling evidence.
So it's more than just saying, hey, we did this procedure, now pay up.
Right.
It requires a strategic approach.
Exactly. The key is to present a well-researched, airtight argument supported by solid documentation. This might involve gathering operative reports, pathology reports, even photos of the wound before and after the debridement, anything that clearly demonstrates the extent and nature of the procedure.
It sounds like a meticulous process requiring attention to detail and a thorough understanding of both medical procedures and coding guidelines.
It is. But remember, we're talking about significant sums of money here. Hospitals and healthcare providers have a strong incentive to fight these denials and recover those payments, ensuring they can continue providing quality care.
And the presentation offers practical advice on how to present this evidence effectively, right?
Yes. It stresses the importance of clear, concise language, avoiding medical jargon, and highlighting the key elements that support the coding decision.
So it's about making a strong case, but also presenting it in a way that's easy for the insurance auditors to understand and agree with.
Precisely. It's about finding that balance between medical accuracy and clear communication. The presentation also suggests referencing relevant coding guidelines and, in some cases, even bringing in expert testimony to bolster the appeal.
Expert testimony. So they might call in a wound care specialist or a coding expert to validate their case.
Exactly. It adds credibility to the appeal and demonstrates to the auditors that the healthcare provider has thoroughly researched the issue and is confident in their coding decision.
Wow. This deep dive has really opened my eyes to the complexities of wound care coding. It's far more intricate than I ever imagined, involving a delicate balance of medical knowledge, coding expertise, and even legal strategy when it comes to appealing denials.
You've captured it perfectly. And it's a field that's constantly evolving, requiring ongoing education and adaptation to keep up with the latest guidelines and technologies.
Speaking of evolving technologies, remember my earlier question about the potential role of AI in wound care coding? I'm still curious about how technology might shape this field in the future. Could we see AI algorithms analyzing wound images, suggesting codes, or even automating parts of the documentation process?
That's a fantastic question, and it leads us into a whole new realm of possibilities and considerations. While this particular presentation doesn't delve into the realm of AI, it's certainly a topic worth exploring further. Imagine a world where AI algorithms could assist coders in identifying the correct codes, flagging potential errors, and even streamlining the appeals process.
That sounds incredibly efficient. But I imagine there are also challenges and ethical considerations that come with integrating AI into such a critical aspect of healthcare.
Absolutely. We need to ensure these AI systems are trained on diverse datasets, free from bias, and rigorously tested for accuracy. And we need to address questions of accountability and oversight. Who's responsible if an AI system makes an error? How do we balance human expertise with these technological advancements?
It's a fascinating frontier with immense potential, but one that requires careful consideration and ethical implementation. I think we could dedicate an entire deep dive to exploring the implications of AI in healthcare.
I agree. It's a conversation that deserves its own dedicated space. But for now, let's return to the insights from the presentation and wrap up our discussion on the key takeaways regarding wound care documentation and coding.
That sounds like a plan. We've covered a lot of ground in this segment, from case studies and coding errors to the intricacies of appealing denials and even a glimpse into the future of AI in healthcare. What other gems does this presentation have in store for us? I'm ready to dive into the final segment of this deep dive. It feels like we've already uncovered a treasure trove of insights. What other gems does this presentation have in store for us?
The presentation wraps up with a really powerful example, demonstrating how to fight back against those denials, especially those related to the RAC audits we discussed earlier. Remember how they uncovered a significant number of errors in excisional debridement coding?
Oh yes, those RAC audits were a big deal, leading to millions in recovered payments. Hospitals were essentially losing money due to coding inconsistencies. It makes you realize how crucial it is to get things right from the outset.
Exactly. The presentation walks us through a common scenario where a hospital might receive a denial for an excisional debridement claim. Let's say the physician documented that debridement was performed, but didn't include those critical details we've been emphasizing: the specific instruments used, the extent of the excision, whether it went beyond the wound margin.
Ah, I see the problem. That vague documentation wouldn't meet the specificity requirements for billing the excisional debridement code. It's a classic case of what's not documented didn't happen in the coding world.
Precisely. The RAC auditors would likely flag it as an incorrect code and demand repayment. But here's where it gets interesting. The presentation outlines the steps the hospital can take to appeal this denial and potentially recover those funds.
Okay, I'm all ears. What are the secrets to navigating this appeals process successfully? Is it a long shot, or do hospitals have a decent chance of winning these appeals?
The good news is that hospitals do have a fighting chance, and the key lies in building a solid case backed by compelling evidence. They need to gather every piece of documentation that supports their claim that the excisional debridement was indeed performed according to coding guidelines.
So it's about going beyond just the physician's notes. What other types of documentation would strengthen their case?
They might need to pull operative reports, pathology reports, even photographs of the wound, before and after the debridement. Anything that provides visual evidence or detailed descriptions that corroborate the physician's documentation.
It sounds like a thorough investigation. They need to gather all the pieces of the puzzle to create a clear picture for the auditors.
Exactly. Remember, we're talking about substantial sums of money, so hospitals are highly motivated to fight these denials and ensure they receive proper reimbursement for the services provided.
And the presentation provides guidance on how to present this evidence effectively. It's not just about having the information, it's about presenting it in a compelling way. Right.
Absolutely. The presentation emphasizes the importance of clear, concise language, avoiding medical jargon, and structuring the appeal in a way that's easy for the auditors to follow.
So it's about translating the medical complexities into a language that the auditors can understand and readily agree with.
You've got it. It's about bridging that gap between the clinical world and the financial world, ensuring clarity and transparency throughout the process. The presentation also suggests referencing the relevant coding guidelines and, in some cases, even bringing in expert testimony to bolster the appeal.
Expert testimony. That sounds serious. Would they bring in a wound care specialist or a coding expert to testify on their behalf?
Precisely. Bringing in an expert lends credibility to the appeal, demonstrating that the hospital has sought out authoritative opinions and is confident in their coding decisions. It adds weight to their argument and showcases their commitment to accuracy.
This deep dive has been a whirlwind of information, taking us from the seemingly simple act of describing a wound to the intricacies of coding, audits, and even the art of appealing denials. It's incredible how much complexity lies beneath the surface of something we often take for granted: wound care.
It's been an incredible journey of exploration, hasn't it? And I hope our listeners have gained a newfound appreciation for the meticulous work that goes into ensuring accurate documentation and coding in the realm of wound care. It's a system with real-world implications, impacting both healthcare providers and patients alike.
I've certainly learned a lot, and I feel much more equipped to navigate the healthcare system with a discerning eye. This deep dive has highlighted the importance of understanding those seemingly technical details and advocating for ourselves as patients.
That's the ultimate goal, empowering individuals to become more informed healthcare consumers.
Before we wrap up, I want to extend a huge thank you to London Heartbeat's Z Academy for providing us with the resources for this deep dive. If any of our listeners are eager to delve deeper into the world of healthcare, I highly recommend checking out their extensive course offerings.
I wholeheartedly agree. Their courses are top-notch and cover a wide range of healthcare topics. And be sure to follow them on Facebook, Instagram, Spotify, and YouTube for regular updates and insights into the fascinating world of healthcare. You never know what intriguing topic we might deep dive into next.
That's a great reminder. Knowledge is power, and staying informed is key to navigating the complexities of healthcare. We'll be back soon with another deep dive, exploring a new topic that's sure to spark your curiosity and expand your understanding of the world around us. Until then, keep learning, keep questioning, and keep diving deep.